Okay, so the HHS secretary went in front of the Senate this week and said, with a straight face, that America pays the lowest drug prices in the world. The lowest. In a country where people are rationing insulin and splitting pills in half. Bernie Sanders pulls out the receipts. Cancer drug Opdivo, 260 grand here, 56 grand in Japan. And you can watch Kennedy walk that statement back in real time without ever admitting he walked it back. Hit subscribe so you don't miss the breakdown. Let's roll it.
Terry Kennedy, how are you? You know, in public life, we all make misstatements, all right? A couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription drugs.
Those drugs we do.
I'm sorry?
For those drugs we do, Senator.
Well, for certain drugs. But in general, would you agree with the Rand Corporation and every other independent survey that we continue to pay the highest prices in the world? In many, you agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for the most common
I'm not
drugs.
saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
The most common drugs we do, or GLPs, or IVF drugs, or COPD drugs, or asthma drugs, for insulin.
Well, let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We pay on the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the Rand Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest prices.
All right. I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs than people in Europe or in Canada. Is that a concept that you can support?
Yes, President Trump wants this codified, and you have a lot more power than we do.
You're right. You're exactly right, and that is why I am going to be offering an amendment to the budget process right now, which would in fact codify what Trump is talking about, that the United States should not be paying higher prices than other countries around the world. Is that an amendment that you can support and get Republicans to come on board?
We will work with you, but in theory, that's exactly what we want.
All right, let me ask you another question. We're on the Help Committee. Casey Means, who is the Trump nominee for Surgeon General, was before us a while back. She agreed with me that TV ads, prescription drug TV ads in America should be banned. As you may know, we're one of 2 countries in the world. Do you agree with that?
Yes, I agree with it in theory. Constitutionally, you can't ban it, but we are now regulating it for the first time, and you'll see that the ads have changed on TV recently because we've sent out 1,000 disciplinary letters.
You may be right, but I think, you know, the people who determine the constitutionality of laws are the Supreme Court.
Well, we worked a lot on it because I wanted to regulate it.
Okay, but bottom line is, am I hearing you correctly to say that you would like to see a ban on prescription drug TV ads?
Yes.
Okay, good. There are a lot of seniors in this country who right now cannot afford dental care. Many seniors have no teeth in their mouths, can't afford hearing aids. I am introducing an amendment to the budget process which would expand Medicare to cover dental, hearing, and vision. Is that something you can support?
I'm happy to talk to you about it. I'm happy to work with you on it.
Other question. Right now, we have a diabetes epidemic in this country, an obesity epidemic. Many parents who would like to buy healthy food for their kids really can't make sense of the labeling on food products. All right? Other countries in the world are quite clear in their labeling about the amount of sugar, et cetera, that's in a product. Are you guys making any progress in coming up with simple, strong labeling on food products?
Yes, we are.
When will we see something?
Well, the delay in it has been that one of the big enemies, as you point out, obesity is costing 80% of Medicaid and Medicare dollars. One of the big problems is ultra-processed food, and there has been no federal definition or any useful definition. We've now worked out a definition. There are other, and here at HHS, we're in the process of going through the interagency process. There's other agencies that are Equity, USDA, Department of Commerce, OMB, and they are reviewing our regulations. As soon as we promulgate those, we already have the labeling ready to go.
Do you have any sense when that will be?
Excuse me?
Any sense when that you'll be promulgating that?
It has to go, Senator, through the other agencies that I don't have any control, but we want it to happen quickly.
Yeah, thank you.
All right, so let's start with what's on your screen. Rand Corporation ran the actual comparison across the OECD. We pay roughly 2.5 to 3 times more for the exact same medications. Same pill, same manufacturer, same chemical formula, different passport. That's not a think tank picking a side. That's the data. Kennedy himself couldn't argue with the moment Sanders cornered him. And watch the move he pulled. You'll see this. 1. Again, first, we pay the lowest for Trump RX drugs. Sanders pushes. Okay, the most common drugs. Sanders pushes again with Opdivo at $260,000. He retreats to, for those drugs we do. That's 4 different positions in under a minute. That's not a policy answer. That's a guy watching his own statement collapse in real time and trying to rebuild it on the way down. Next piece. Prescription drug ads on TV. Every smiling couple in a bathtub commercial you've ever seen. The United States and New Zealand are the only 2 developed countries on Earth that allow this. Everyone else banned them decades ago. Because when a patient walks into a doctor's office asking for a specific brand name drug they saw on TV, the doctor prescribes more, pharma sells more, and your premium goes up. Sanders asks Kennedy point blank, do you support banning them? Kennedy says yes, in theory. Constitutionally, you can't ban it. That's the dodge. Kennedy's not a constitutional scholar. The Supreme Court has never ruled that drug ads are protected commercial speech in the way he's implying. New Zealand banned them. Other countries banned them. The constitutional hurdle is an excuse, not a ruling. And Sanders called it right there. This next one should make every senior in America furious. Traditional Medicare, the program you paid into your entire working life, doesn't cover dental, doesn't cover vision, doesn't cover hearing aids. Seniors are walking around with no teeth, can't hear their grandkids, can't read their prescription bottles. And the program they bankrolled for 50 years says, that's not our problem. Sanders wants to fix it. And Kennedy's response? I'm happy to talk to you about it. I'm happy to work with you on it. That's the full answer. Happy to talk, happy to work with you. Nothing about will the administration back it. Nothing about a timeline. Nothing about will you publicly endorse this. Just happy to talk. You know who else is happy to talk? Every lobbyist on K Street. Talk is the cheapest currency in Washington. Happy to work with you is Kennedy's version of I'll get back to you. Now here's where it gets really frustrating. Americans spend their lives staring at nutrition labels they can't decode. Other countries slap a big red warning on anything loaded with sugar or additives. We get 14-point fine print about daily value percentages most people couldn't explain if their life depended on it. Sanders asks Kennedy, are we making progress on simple, strong labeling? Kennedy says yes. Then listen to the follow-up. Sanders asks when, and Kennedy goes, well, it has to go through USDA, Department of Commerce, OMB, interagency review, the whole thing, translation. It's stuck for months, maybe years. Ultra-processed food is eating 80% of Medicare and Medicaid spending, according to Kennedy's own number. 80%. And the response is, we're an interagency review. That's not urgency. That's bureaucracy wearing a concerned face. And look, we live in a moment now where AI can fake anyone saying anything. Deepfakes of politicians are getting passed around like trading cards, which is why clips like this one matter. Because the words you just heard from the actual HHS secretary on the record in front of a Senate committee are not doctored, not edited. That's him saying America pays the lowest drug prices, while cancer patients here pay 5 times what a Japanese patient pays for the exact same infusion. So here's the line. Take this with you. Americans pay 2 to 3 times more for prescription drugs than every peer country on earth. The HHS secretary just claimed, we pay the lowest. When cornered with the numbers, he narrowed it, softened it, and redefined it 4 separate times. That's not confusion. That's choreography. If this breakdown helped you see through the spin, hit like, subscribe, share it with someone who still thinks pharma pricing is complicated. It's not. It's just protected. I'll see you in the next one.